Hi, my name is Haley. Today we're going to demonstrate deep tendon reflexes. So first, you're going to knock on your patient's door, you're going to open it, provide privacy, wash your hands, verify your patient. Can I get your name and date of birth?
It's Luke, and it's 2284.
Awesome. That is the right patient. Today we're going to check your deep tendon reflexes. So what we're going to do is we're going to take this little hammer and we're going to do some little taps, and we're looking for your responses. And your nerve responses are going to show me and tell me if there's any kind of issue or if they're normal reflexes. Okay? So this is especially needed for pregnant women, as it can be a sign of preeclampsia. So if they have preeclampsia, they're going to have hyperreflexes. So there we go. So hyperreflexes can be a sign of preeclampsia, especially indicating seizures. So the higher the response is usually prior to a seizure. Also, a lot of women are taking magnesium sulfate via IV. So if they have too much magnesium, zero reflexes can indicate that it's too much, or doctors can use it to check how much magnesium they need, or if they need to start a drip of magnesium based off their reactions of their reflexes. So we are looking for involuntary spasms, which would indicate clonus, and then we're looking for a normal response. So it's graded on a scale. 0 means there's no reflexes, and this can indicate possible nerve damage. There's +1 is where he can have reflexes, they're present, but they're not super active, and this can be a possible nerve injury. There's +2, which is normal, that's what we want. And then there's +3, which is brisker, or a little bit more than normal, not necessarily an indicator. And then +4 is brisk, and it's hyperactive with a little bit of clonus, so involuntary movements, and this can signal upper motor neuron issues. So today we are going to check the bicep, tricep, patellar, Achilles, and we're going to look for clonus. Okay, so you ready, sir? We're going to check your biceps first. So to check his bicep, we are going to look for where it flexes. We are going to put our finger on the tendon right here, and we're going to take the pointy part and we are going to relax your arm. Thank you, sir. And we are just going to do a tap. So he twitched here and here, and it was normal. You do it one more time. So a little slight movement, so that's looking good. Next, the tricep. So the tricep, you're going to want to add a 90-degree angle, and you're going to go right here on the elbow, and you're just going to take it, and you're just going to do a nice little tap. And so this one's harder because there's a flex here and a little bit right there. And you're going to look for it with the flat end. Okay? The next reflex we're going to do is the patellar reflex. Legs have to be dangling. You're going to support the back, and you're going to look for the tendon. And if you're curious, you can flex his leg out and bend it, and right where it bends underneath the kneecap, can you do it one more time for me, is going to be our reflex. So you're going to use the flat part of your hammer. Okay, so you're going to do a brisk tap, and he did have movement. Okay, the next one is going to be the Achilles. So you're going to go down to the ankle. Okay, so you're going to support the foot, and you're going to go back behind and do a tap. Okay, so on this one, you are looking actually for his foot to go down. So when it points down, that's indicating the proper reflex for the Achilles. The last one you're looking for is clonus. So you can do it with a pregnant woman laying down or just flat, and you're going to take the foot, you're going to have it pointed, and what you're going to do is you're just going to lift the foot up really quick, and if it were to continue shaking, then that is clonus. So relax your foot, sir. Okay, and go up, and his just stays flat. So we don't have any twitching or spasming. If it were to start doing that intermittently, then there may be a problem. And for a pregnant woman, it could indicate a possible seizure. Okay, so when you're done, you're gonna say, good job, explain to them what the reflexes are, wash your hands. Are you comfortable? Can I get you a pillow, some water? Yes, you're glowing. All right, and then close the door and you're done.